Yes, we can.
Awesome.
I can.
Awesome. So I guess everyone can. So once again, I would like to thank you all for joining us today and for sparing your time to come and celebrate with us. So today we are going to have a webinar that's the closeout for mapping for mental health in Kenya. So again, you all know me. If everyone knows me, if not all. My name is Rebecca Chandiru, and I will be leading this session today. Okay. So the agenda for today, I will be doing the welcome notes, I'll be doing the housekeeping, and then thereafter we shall have some time again to look at the achievements and celebrate the work that we have contributed together. And then we have our stars, our champions that will represent the rest of the champions. That's Miriam and Francis, that will talk about their experience and how they see the mapping moving forward. And then we shall have our key speaker that will join us in a bit, that will lead the session of recognizing our top contributors, and will speak to us in a bit. So lastly, we shall be closing and take a group photo. So mental health mapping. So in the week of 12th October, a group of volunteers from Kenya contributed their time to map for mental health, and we were mapping in celebration of International Youth Day. So using MapRoulette as a tasking platform, we also used ID Editor and JOSIM as editing tools. We were able to update the map to be more specific, health facilities, where we added hospitals that offered counseling services, psychotherapists, and also we added an attribute, or whether or not a fee attribute, that is whether or not the health facility offered the service for free or it was paid for. And then we were also able to add a description. This description included the time when the service was offered, or the amount of money that someone required to get that service, and many other descriptions that were necessary in regards to that health facility. And then we also added the operator type, whether it was a government facility, whether it was managed by, let's say, an NGO, etc. The operator type, whether it was a public hospital or whether it was a private hospital. So in celebration for that, the volunteers were able, actually we trained over 34 participants during that time. We only had one training. And then our volunteers updated 388 health facilities. Isn't that great? Can we give a hand of applause, a virtual hand? Let's celebrate our mappers now. And then out of the 388 facilities, we were able to add 248 fee attributes. That means right now, when you check our map, you're able to see the hospitals that offer free counseling services, and also able to see the ones that are paid for. And you also have information on whether or not the time or the amount of money that is costed to do the counseling service there. Isn't that great? I would just like to stop my screen for a bit to just celebrate. I would just like us to celebrate the work we have done. Thank you so much. Before I continue sharing my screen, I would like to just thank you all for sparing your time to contribute to the map. Thank you all for adding data to the map. We celebrate you. We appreciate you. You are doing a great job as the youth and the future leaders. Yes, thank you again. I'll share my screen again to contribute to our celebration. Um, okay. So just before I continue going to the next slides. This information was added just on our desk. Our volunteers were able to get this information from different websites. They got contacts of the hospitals. They called the hospitals and got this information, meaning they connected with different stakeholders and different health facility leaders and doctors, and they were able to add this data on the map just while seated on their desk. So with the available resources, the available open source tools, we are now able to say that we have contributed to the map, and we are part of the people that have solved mental health issues in our communities. Thank you so much. So this is just the map of what I've been talking about right now. With this map, you can be able to identify which health facilities are for free, and the ones that are being paid off. Yes. So this is just this same thing I've been talking about. Shortly. So in the next session, I would like to again appreciate you, Miriam and Francis, for representing the volunteers. These are not the only people that contributed. There are so many of them, but these are the representatives, and they will be speaking on behalf of all the volunteers. So for starters, I would like to welcome Miriam. I'm going to stop sharing my screen, and Miriam will be able to speak about her experience in a bit. Okay. Stop sharing. Miriam, are you able to unmute and speak?
Hi, Becky. Yeah, sure, I'm able.
Okay, let me just do this. Okay. So Miriam, if your internet accepts, we would like to see your face, but otherwise it's okay. You can just tell us, you can just go ahead. Thank you so much.
Okay. Hi, everyone. My name is Miriam Malay Shapashina. I'm a student at Jomo Kenyatta University of Agriculture and Technology. Yeah, and I'm happy to be here. I'm pursuing a course in geospatial information science. And yes, first of all, I'd like to take this opportunity to thank Becky and the team for just giving us an opportunity to take part in contributing in enhancing mental health facilities, especially for the youths in our country, Kenya. Yeah, that one was really amazing. Thank you so much. Yes, so for International Youth Day, we participated in mapping a project in Kenya where we focused on identifying hospitals and health facilities that offer counseling, especially for the youth. And personally, the importance that I've seen this project in terms of just us contributing and, enhancing health facilities in Kenya, and also providing accurate data that can be used in future. We can see the importance with recognition that us as youths, we face many mental health challenges today, and also access to the counseling services is often limited. So accurate mapping will really help in, knowing where to find places where we can get assisted in terms of getting counseling services. Also, the data collected can also be used in NGOs, governments, and for just to plan for future or to plan for better mental wealth for us youths. And just this project really reminded me that by mapping these facilities, we are not only helping young people access counseling services more easily, but also creating open data that decision makers can use for planning, that is in future. Yeah, just to mention, like Becky has said, the tools that we use, that is MapRoulette for task coordination. We also used for Personally, I used JOSM for adding and editing the hospital data. What we did was verifying if hospitals existed in the different places as provided by the team. We also checked if they provide counseling services and updated the details such as the names, locations, and the services offered there. And this was all done through teamwork. As you can see, we are many of us here. So this one was done through us collaborating as a team and, contributing to enhancing the mental health services in our country. So I collaborated with my fellow mappers here to ensure the data collected is accurate. And this also enhanced our skills in mapping by using MapRoulette for those who are, first time using the software. This helped us in also using it and, being perfect in using the software. Some of the challenges I personally faced, I think also I had someone somewhere mentioning it, was finding reliable information on which hospitals truly offer the counseling services and also reaching out to the different hospitals. Most of the contacts available online were unreachable. However, the challenges taught me the importance of patience and accuracy, and also collaborating makes mapping more effective. And mapping is not just about technology, it's about solving real community needs. The impacts of this project, I hope that the data created will help youths access counseling services and add value to global platforms such as OpenStreetMap. So yeah, this project showed me that even a small contribution in mapping can have a big impact in improving access to healthcare for young people, and I look forward to participating in more projects like this. Thank you so much, Becky and the team. Yeah, that is my submission. Thank you.
Wow. Thank you so much, Miriam. I'm really looking forward to working with you on the next project. Thank you so much again for contributing. Please continue. Don't stop here. Yes, I would like to call on to Francis. Thank you.
Okay. Thank you very much, Becky, and also Miriam. I think Miriam has just talked almost about everything that I had already prepared to talk about, but I won't lack one or two things to echo here and there. First of all, my name is Francis Nderito. I work at GRI, and also I also volunteer as in the working group from OSM Kenya. And first of all, I would say thank you to Rebecca and the HOT team for giving us this chance to contribute to the mental health campaign in the International Youth Day. First of all, the task was not as easy because we had some few challenges here and there, but it was really encouraging to see how much mapping can be so impactful to the society, not only to the society, but also to the young youth. As one of the, I like one quote from one person by the name Mahatma Gandhi, who says that we are the change that we would like to see in the society, and change begins with us as the youth. It is very, very key. Some of the things that the challenges that I faced personally is some of those facilities that we were mapping. We were finding them out to be like, you find a person mapping an area that is not a hospital, and you have to ensure the actual facility that is mapped as a hospital is really a hospital. And some other challenges is you find out that some of the maybe like what the things that they offer in the hospitals. Some of them are not accessible maybe through the internet, and it's somehow challenging, which may be a very good also thing to ensure that the data that is provided is accurate and very, very crucial to the youths. Some of my takeaway is that really collaboration is very key. And I think from this platform that Rebecca and the team has given us to contribute to the mental health of the youth, it's very, I think that's a thumbs up to Rebecca and the team. And we are calling for more and more similar campaigns. And we are ready to contribute to all those campaigns. I think I have also been into similar campaigns together with Rebecca, but maybe she has never maybe seen me, but I really like to get in touch to these kind of contributions. Thank you very much to Rebecca and the Humanitarian team. Thank you.
Thank you so much, Francis. We shall keep in touch. Thank you again for representing our volunteers. So are you well represented? Volunteers that contributed to the map, do you feel well represented? I feel you're well represented. Everything has been said. And one thing that I love about this campaign is that even with the challenges that we faced, we were able to update 388 hospitals just in a span of 1 week. It's very, very great. Thank you again. I'll just continue. I will share my screen for a bit. Yeah, thank you. This thank you is for all the contributors. We are celebrating all of you. So just a small bit about the campaign. I would just like to share what exactly this campaign demonstrated. It demonstrated leadership skills in our youth and their readiness to contribute. So you've all realized that the people that contributed to this campaign are all youth, they are all young people. And you've seen how they were able to take up space, even with the challenges, were able to take up space and update the map. The other thing that this campaign has demonstrated is the power of digital tools and open mapping tools. So just with your mobile phone, with the different websites, we were able, and the simple tools that we used, like MapRoulette, like ID Editor and JOSM, that was just taught in 1 day. We were able to just add those so many, we were able to update those so many hospitals, adding mental health services, making it visible on the map. Just imagine, as per 12th of August, like that data wasn't on the map. But right now, as we speak, the data is on the map, and anyone, any organization, any humanitarian organization can actually use it, or even the government can use it to make decisions, to make informed decisions for our youth and the community at large. And again, it just showed the passion of volunteerism. I would just like all of us to give a virtual clap or a heart to all the volunteers that contributed to this mapping. This campaign was 100% on volunteer basis. We did send any stipends. Volunteers spent their internet. They spent their time aside everything. They took time for about a week rather, just to contribute and update to the map. I would just like to send you a huge heart from me. I don't know if you can see my face. Thank you so much for volunteering. Thank you so much. Continue volunteering, because through this volunteerism, you're changing the world. You are helping communities at large aside the youth. And again, what next after here? So we have created the map. We have added, we have created the map. Yes, we have updated our map. What's going to happen then? So we are going to share this data set with our partners to make informed decisions, like I mentioned, in Kenya. And again, please feel free to share this data with anyone in your organization. And some of us are students. If you're doing any research in regards to mental health, please feel free to use this data set to just use it in your research and make it better. Then another thing we are going to do, like I mentioned, I've been mentioning this, data on OSM is available. It's open source, it's free and available for anyone. When I say anyone, I mean anyone, extremely anyone, any stakeholders across Kenya, any communities, any students. Yeah, please make use of this data, use it in your research, use it in your organizations, and let's change Kenya. Let's make this open source data useful and impactful once it's already created. Next is our guest speaker. Let's celebrate our guest speaker. First of all, I would like to thank you so much, Dr. Adede, for sparing your time and for accepting to be our guest speaker. We appreciate you so much, and we really look forward to your session. Yes, thank you so much, and over to you. I'll stop. I'll think. Yes, you can. I think I'll share my screen as you speak. Dr. Adede, are you around?
Yes, I'm indeed around.
Okay, so would you like me to share my screen, or you'd like to share the screen? Okay.
Sorry, it's okay. I can go right ahead. I'll be speaking through this initially, then I can indicate when we can move the slides.
Okay, so I can stop for a bit. Okay, thank you, Dr. Adede, for joining us. We are excited to have you. Everyone, let's celebrate our guest speaker. Happy to have you.
Yeah, thanks everyone. I think on the background you'll see perhaps a not very nice drawing. I think the person who drew it has improved on what skill they have now, just like you have all indicated that from this exercise you've picked the use of a few tools. So just to break the ice. But then I would take the opportunity to just indicate that coming up after the two speakers, Shapashina and Francis, I feel like I would be going over points that they have said, but nonetheless, I'm happy to see a task that was clearly well understood, and the impact of which was clear to those who did the work. I think sometimes we do tasks, but don't see the ultimate picture of how that comes out. But I'm happy that the team here sees the value that you have created. And so I will begin by thanking each and every one of you for the dedication you've shown in mapping the mental health facilities. I think not just the facilities, but the alone, but also the indication of where you can get mental health services and at what cost. I think sometimes we overlook the cost element. And so it's not just the distance that I would be interested in to the nearest facility, but knowing what and if it is possible to get the services that I need for the time. I also want us to see that it goes beyond data, what we have done. What we have done is to create a resource that is living, a resource that we have to really strive to update. So as we go over time, these attributes we have created could change. Facilities that have services, that never have services, could have them. And so striving to also keep this updated is something that is going to be one that we should be committed to. More importantly, that this is a resource that connects people to care. And ultimately, this will guide policy and most importantly, and I think I can't state this enough, and I will quote one of you who says that this brings mental health issues to the fore. And we know the issues around mental health, the stigma, the lack of information, unequal access to services. And so this tool that you have created breaks these barriers. And it means that not only will we have data, but the data will not be locked away. I think the power of open source is one which I relate with. And I'll take a minute just to indicate, a minute or so just to indicate why. So I work for Medic as a research data scientist. And some of the things we at Medic, we are open source by heart. So we commit to create tools that are open source. And that means that, for example, one of the tools we've created, the Community Health Toolkit, is usable free of charge. And you can always get to, just a minute. So just connecting it back, you can always explore the Community Health Toolkit. I think this is now supporting the delivery of services across 22 different countries, Kenya at national scale with 106,000 community health workers. But then you realize that for you to use such systems, you must have a very vibrant community. And communities are about collaboration. It's about people bringing in, you know, their understanding of tasks, contributing that together to create something that makes a difference for the same community where they belong. I'm happy to indicate that we struggle at this point, and I'm saying happy because that's an opportunity. We struggle with mapping, and we are here exploring this with hot OSMs, and just indicates that we really value the work that you have done, and as one of the stakeholders, we'll be championing their use. Our lowest level of organization of community health workers is called the CHP area, the Community Health Practitioner area. And these CHP areas are organized along health facilities, so multiple areas to a health facility. So there is a chance, and the biggest chance, that whatever you have mapped and the attributes you have created could be joined to that data, and then we have an indication on those facilities at that given lowest unit of administration and hierarchy in this case, to know where there are health services. And of course, we all know as Kenyans that there's a very big shift to focus on non-communicable diseases. So again, a very big opportunity that we get from this. And of course, just to indicate that the power of open source and communities is quite something that we keep exploring. And having walked the journey, and the impact definitely coming to show in our faces not long from now, it's good to appreciate that the little time you invest goes a long way in solving the problems that exist in the community where we come from. So again, take a minute, celebrate yourselves for the work well done, and for the work you made easy for the community where we belong. And with the commitment that is given by HOT OSM team, you are sure that this will indeed make a difference.
Great. Thank you so much, Doctor. Thank you so much for that informative. Thank you for, you've actually given us some information and data about Kenya that some of us did not know. This is very great. We really look forward to exploring open source tools together with you. I think next is celebrating our top participants. Again, this thank you is to everyone. We really appreciate everyone that has contributed, or even the one that just attended the training. Next time, they'll probably get time to contribute to this training. So I would like again to take this opportunity to hand it over to you back, Doctor, to continue with the recognition. First on stage is Barbara. Over to you. Thank you.
Thanks, and I know we are celebrating a number of people, but in totality, we celebrate everyone. I think it's collaborative work. So we did reach out to some of you to make a statement. Doesn't mean that they contributed way above what others, but just to always give a hands up and a thumbs up for work well delivered. So Barbara Mongina, I think you go up first. And we make this quite free. So if you want to come onto the screen, you want to say a word, or if just you want to wave, all accepted.
Allow me to thank you so much, Dr. Adede and Rebecca. This was one of the most humbling experiences to map, and I just want to say thank you. Thank you for this recognition, and I love helping the community so much, so I don't think that this will stop. This will go a long way to solve problems to communities. Thank you so much. Such a humbling experience. Thank you.
Thanks and welcome. I think as it's indicated, people will get information about the mental health facilities available in Kenya, the distances, what it takes to get the services, and welcome. Thanks and keep the good work. Next. Sarah Mwangi. I think I find this quote quite powerful. Most of the time we hide mental health challenges. But then now we have them and access to the services on the map. Sarah, if you want to wave, say a word. We celebrate you, Sarah, and really hope that this data gets out of a few hands to be truly open source and as it is and usable by many. So I would then recognize Kennedy Kambi. Maybe if you are there, maybe just a hands up, a thumbs up from you. Thanks. And next, Lucy hopes that the data will be handed over to relevant stakeholders. I think this is perhaps the biggest guarantee that HOTO-SM has given. And sitting here as one of the stakeholders interested in using the data is already a plus. And of course, to continuously identify any gaps and fill for them. Yeah. Thanks, Lucy. Indeed. Francis has spoken before. I think he's a seasoned volunteer, and happy to note that Francis. We celebrate that, and you indicated that maybe you haven't been seen. I think more than ever, be very assured that whatever you do as open source gets seen. Sometimes ahead of you, when people ask who created this data set, and those times it's you, the answer on the background. So thanks. Celebrate you. And Sheila, I hope people will see from the data that mental health services in Kenya are accessible. From the profile that we have created, indeed, and for tools that will link to the data, we'll be very interested to see if these data back to indicate, who visited these services because of the mapping that you did. The spotlight now on Tony. But Tony's hope is that this sheds light on the importance of such a service, especially to the youth. And we know how much mental health is a challenge to the youth. So in the spirit of Tony, I would say this is youth solving the youth's problems and giving benefits to others. So thanks, Tony. Shapashina had spoken, I think, quite powerful. And maybe if you just have a second, you could reiterate the quote that you have.
Pardon, come again, please.
Just indicating if you have a second, you could just take us through the quote that you have. I realize that you refer to this as mental wealth. Quite something.
Yeah. Yes. And the quote was that the project just showed me that even a small contribution in mapping can have a big impact in improving access to healthcare for young people. Yes.
So we can make our mental health become our mental wealth. Thanks for that. And quite profound. And Chebet White, if you are here, just a hands up. I think you see this as reducing the barriers to mental health care. Agree to that indeed. And thanks for the effort that you put in. Omolo Fajala. So your hope is that the counseling services offered in the health facilities, days of consultations and the fees paid where applicable are some of the things you take away. I think, like I was mentioning, maybe once we link the data, it should be quite interesting to get this back from the users of the data from the mapping exercise that you did. Yeah, indeed great. And I think I'll thank everyone who was involved in the project and get it back to Rebecca.
Awesome. Thank you so much, Dr. Adede. I would like us to give a hand of applause to our guest speaker. We have learned a lot about you and really look forward to connecting with you and look forward to inviting you to more of our events. So as volunteers, we always have mapathons, we have different mapping events, and we really look forward to inviting you and for you to attend. Thank you so much. And yes, let's continue. Today is a day to celebrate. So let's continue celebrating our work. Next, I am just going to share on this. I'm going to share, just copy this. Let me share my screen again. Give me a second. Okay, so thank you again. Let's all right, so what is coming up? We're going to have an internal retrospective where we shall do lessons learned, and we shall share back a blog as soon as possible. The next thing I'm going to do is I'm going to send certificates to all of you that contributed, and we shall be sharing a blog. The other thing, just to celebrate you, a small token of appreciation, we're going to send you a lunch voucher just for you to go out and have a good meal. If you know any of the volunteers in Kenya and you have all contributed and you're getting lunch vouchers, you can get that time just to meet up and have lunch together. Yes, thank you so much. So for future collaboration, you can get in touch with us in our different socials. If you can share that with them, Paula, that would be great. Then another thing, I'm going to share a link of our WhatsApp group. If this is something that you're interested in, we have our WhatsApp group where we share different geospatial activities. We share different opportunities, let's say grant opportunities. We also share job opportunities, if any. We also share different mapping activities coming up. So I'll share that group with you in a bit. And if it's something that you're interested in, please feel free to join us and you'll get all the different events updates therein. Yes, thank you so much. This has been really a good ride. Thank you so much for attending in many numbers. We are over 45. We've been over 45. People have been dropping off for a bit. Thank you so much for staying until this time. Thank you for contributing. We appreciate all of you, even those that haven't appeared in the slide. It doesn't mean that we don't appreciate you. We see you. We appreciate you. Thank you for contributing to the map. Please stay in touch. And I'm going to share the WhatsApp link in a bit. If it's something that you're interested in, please join us on WhatsApp, where we talk about the science of where. I think that is it. And if you'd wish, if your internet allows for, please open up your cameras. Let's wave a bye or maybe take a group picture. Happy to see you. Okay, I'm just giving a couple of minutes for people to turn on their cameras. Sorry, Isaiah, I just pinned you by mistake, but you looked good pinned. Please turn on your camera, Isaiah. Okay, who is excited? I feel like this was very exciting. We got to have a very great guest speaker. I loved everything. We talked, like, it was very, very good. I'm really happy. I'm going to have a good day, by the way. So yes, I don't know how many screens you have, but I will just take a screenshot. Please take screenshots and share on the social media. Let me see on my end. Okay, so I'm going to just count 1, 2 until, I don't know, until 3. Oh, we all say mental health. I don't know. Anyway, I'm taking my first screen. Okay, I will save this somewhere. Let me just take a second one just in case. Okay. Please take screenshots, whoever can, and we shall all share. Okay, great. Thank you all for joining us. Thank you for joining us from different countries: South Africa, Kenya, Rwanda, Botswana, Somalia, etc. Barbara, good to see you. All right, bye everyone.
Bye. That's a nice one.
Bye-bye.
Bye.
You let it